Hi, I am so happy you are joining us today. My name is Ann Edenfield-Sweet. I'm the Executive Director of Wings for Life International, and you are now part of our Wings LifeWise family workshops. And we're calling them LifeWise because a lot of people are streetwise. We want to also help you to be LifeWise. And today we have Susan Merrill, a wonderful, wonderful woman who works for the New Mexico Department of Health. She is a member of the CARA team, and CARA stands for the Comprehensive Addiction Treatment Act, where members of the Department of Health work with families that are having newborns and plans of care, and especially if there's any kind of substance abuse involved. She has worked for a licensed social worker since 2002 and the Children's Medical Services. She's a medical social worker as well as a coordinating social worker that works with care and assisting families with long-term medical needs since 1990 after getting her master's in social work. She is so well-connected. She is so aware of everything. And today she is going to talk about self-care for families doing COVID-19. And I am just so happy to have her today. So here we go. Welcome.
Thanks, Ann. Hi, everybody. And I hope you are all somewhere comfortable on this really hot week. So I am going to be speaking to you today around self-care for families during COVID-19. I'm a community and social services coordinator for children and youth with special health care needs. That's the program Children's Medical Services. And just a little brief, we serve children birth to 21 years of age. So we're going to start with COVID-19, just a little bit of 101. How does COVID affect children? So I have been talking with families. New Mexico was the first state in the country to identify that children might be affected by COVID. They might actually get COVID or have family members with COVID, along with pregnant women. Why? Because where I work, we're all about prevention, and we're all about prevention of children, especially with needing long-term medical care. And when we have a new virus, we need to know. So last year, in March, I worked closely with my bureau chief at the time, Dr. Janice Gonzalez, who's now the chief medical officer at the Early Childhood Education Department, and with my lead epidemiologists, who are all fabulous. And we worked together with the CDC, along with another agency called Mother to Baby, which is also an arm of the CDC, to put into place some protocols to assist families. So I've been talking with families since the beginning of the pandemic, a year ago. And my particular work is directly around babies, 12 months and under, and pregnant women. So the first myth I've heard is, I heard that children do not get COVID. What's been happening is that sometimes parents will be positive for COVID and they'll have a little one. They'll have a baby under 12 months of age. And a lot of times providers are saying you don't need to test your child, and I'm going to talk a little bit more about that, but we're just going to assume they're positive. So number one, children, birth, newborns, and up can test positive for COVID. They rarely test positive, newborns rarely test positive at time of birth. And that transmission is still not understood, and that is on the CDC website, which I look at all the time, because it doesn't necessarily cross over during the pregnancy, so it's typically maybe after, it's just not clearly understood. But what we do know is newborns can go home, right? And then somebody comes to love on that baby. Well-meaning, well-intentioned, but they might have the virus and not know it. And then the next thing, you have your family. Symptoms in children can range from mild to severe, just like adults, but they tend to recover much quicker, which is great. And in New Mexico, our children have done very well overall. So I always caution families to be careful when watching the national news, because we don't look a lot like the national news. Let me just say it like that. So we've had not a lot of hospitalizations. We have not seen a lot of that scary one, the MIS-C diagnosis, just so people are aware of that. But for the parent who's had to deal with this, it can be pretty significant and pretty scary at that time. So I don't want to dismiss if you've a parent of a child who's been very sick with COVID. That can be very challenging. Myth number 2, I was told if I was positive, I should treat my child as positive, which I mentioned early on. So the Department of Health does not treat your child as positive without a positive test. Why? Because it's a virus, and it's a virus that incubates. And your child can be asymptomatic when you're really sick, and 2 weeks later, then they become sick. The other problem is isolation. So if you're a parent that works, and you're like, okay, I'll be isolated for 10 days, and after your 10 days, you're doing great, and you have no more symptoms, and your doctor says, okay, you can go back to work, but you've got your child at home. Well, guess what? You need to be another 14 days quarantined. That is a total of 24 days. That's a hardship if you're a working family. So I want people to think about it like that. Unless you're a stay-at-home parent, that's fine. But your child still cannot play with other children. Your child still cannot go to preschool. They cannot go visit grandma and grandpa. They still need to quarantine because this virus incubates. And children can spread COVID. So about a year ago, that wasn't necessarily thought. They weren't sure. But guess what? Kids spread, kids share germs, right? They share the flu, which is why we probably haven't had a lot of flu. Because they haven't been around each other as much, maybe. I don't know. I speculate, but I think. So I just think about it in a logical way, and they can spread this virus. So without knowing if your child is positive or negative, here's the other thing. How do you appropriately care and treat your child? I've had lots of parents who've gone to get their child tested, and their child is negative, but their child is still sick. So then I always ask, well, did they test for flu? And depending on the age of the child, did they test for RSV? And I really feel for moms and dads because they say, yeah, I had to go back and tell them to do that. So that's the other thing, to be an advocate for yourself. When you go to a clinic, ask that they run every test they can run so that you really know what is going on with your child, so that you're not guessing. Your child might test negative, but then have COVID symptoms. That's not uncommon. We have more false negative tests than false positives. So a lot of times the question comes because people get the rapid test, right? And the rapid test, if it's positive, is typically a true positive. If a rapid test is a negative, then you do need to go and get a second test because those are not always the best indicator for this virus. And that's been known since last year. So it's really important to ask the provider. Again, I'm going to repeat this, testing your child. Also test for flu, RSV, depending on the age of your child, and any other test based on your child's symptoms. So we have seen underlying strep throat, sinus infections, and ear infections in children as young as 3-4 months of age. So I just can't overstate that enough, that you don't want to miss or not know, so you know what you're treating. And many babies who are teething also have been COVID positive. So I am really aware because I talk to so many families, and so last year I wasn't hearing so much about the teething. Well, then January hit, and all of a sudden it was, well, the baby was teething and there was no other symptom, and I'm like, okay, it's just interesting. It's anecdotal is what I'll say, but it's important to note because when babies teeth, they also can run a fever, right? And they also look like they have a runny nose. They have all the same symptoms. And so this past winter, spring, that is what we've been seeing. If somebody chooses to take their baby to be tested, they're probably teething, and they may likely have COVID as well. It's just one of those things. It's just like the allergies, right? Last year, when COVID hit, we were really trying to decipher, is it allergies or is it COVID? And we now know if it's a symptom of either or, you get tested. Well, it's the same thing with children. I am breastfeeding, and is it safe to continue? Absolutely. A year ago, Everybody was like, okay, you got to separate mom and baby. If mom is positive, she needs to isolate. I'm clearing my throat. Bonding is so important with newborns, that bonding and that love. And virus or not, what is the natural thing we're going to do when we go home with our newborns? We're going to want to love on them. We're going to want to be with them. And being isolated is so hard. And I really, really cherish the families that I've talked to. I've had a lot of mamas that made some decisions, like they had a grandma or somebody, that could come in and help them. And they made that decision based on their own COVID symptoms to separate because they were so worried about their baby. And bless them for doing that, because that is really challenging. But here's what's important to know. COVID does not pass through breast milk. Does not. There's no proof. And what's important is we really believe, and we're really hoping, I haven't really seen the science just yet, but I'm sure we'll see it. Just like women who get the flu in our breastfeeding, they pass off what's called, I think it's IgG. I'm not, again, but I know it's an antibody immunity that they give the baby from the flu. We're really hoping that it's the same with COVID. I know we're going to have more information on that because people are looking at it very, very carefully. The Mother to Baby organization that works with the CDC has been gathering that information. So if your baby gets COVID, call your primary care. Monitor for the severity of the symptoms. Watch for fever. Fever is huge, right? But it's not the number one symptom. And then the other thing is to watch the breathing. With newborns, they teach you in the hospital to look for the lips turning gray-blue. But when they're really little, that can be one of the biggest things, is the challenges. And those are the times when you want to call the pediatrician or you want to take them to the urgent care when you are really concerned. The other symptoms we see are watery eyes, stuffy nose. It looks like a severe cold and flu all in one. This is what this virus looks like, if you think about that. Because you get the GI symptoms, you can have that, not wanting to eat, the tummy hurts, the body aches, and then along with that, you might get an earache, you might get that congestion, and sometimes a rash. So what's interesting is that last year, that's what I started to collect the information on. Parents were reporting rash. And then all of a sudden that ended up on that list. So it's not the typical rash you see on a baby. It looks like a little raised, red, bumpy. Most parents report it on the chest, torso area, and it can be easily cared for with something that's just calming if it's itchy. Like parents have used oatmeal bath, parents have used lavenders, whatever works for you, for your child, or even a cream if the doctor recommends it. That's what's important, and it typically disappears and goes away. Now I understand adults are getting this rash now too. So I did want to make mention of that because that's kind of new this last year. Don't panic. This is the first thing I want to say to everybody. We've come a long ways with this virus, right? But the biggest thing is it drives everybody's anxiety because, one, we're telling you have to stay home, you have to isolate, you can't go anywhere. But, New Mexico has a great blue sky, great sunny days. And one of the important things to think about is where you live. And if you're in an area that has a contained backyard space where there's nobody around, and you have a child that needs that sunshine and that air, and you might need it yourself, it's okay. It's okay to go out and get some air in your own confined area and your own confined space. We're just asking you not to go to the store and not to do your regular daily shopping or whatever it is that you do, or have people over. I think that's the big thing. Treat your children like you would if they had a severe cold or if they had the flu. What would you do? What would you have done? Now, for a lot of parents, this might be the first time. So of course, getting that guidance, that's what we're here for, and we're happy to give that guidance. But if you're familiar with that and have other children, you would just follow that same course. And you always call your primary care doctor as well to get that guidance. Call the nurse line. We actually still have the COVID hotline, the nurse line. The next big question is, when is it safe for my child to go back to daycare or to a preschool setting? Well, there's a couple things to think about. One is if your child is being cared for in a private daycare setting, The state has no jurisdiction over private settings, but with our public or the settings that receive state funding, there's a whole team that goes in when there are COVID positive little ones or daycare providers. It's called a rapid response team. And they will shut that daycare down for a couple weeks. Everybody gets tested, a letter gets sent home. I know a lot of parents have been through this. So what I say to parents as my cautionary is if you have someone who's outside of that system of care, caring for your baby, just ask them if they've been vaccinated, have they had any symptoms, to please follow the protocol and guidelines. Because if you've not had your child tested for COVID and you don't know about, if your child is positive or not, you might also be re-exposing them again. The other thing is your child really does need to quarantine for that total of 24 days that I mentioned earlier. So unless you determine that you want to get your child tested and know the results of that test. It's really important to stay calm and not be afraid. Don't hesitate to reach out and ask for help. Or if your ask the doctor. And if your child's symptoms are concerning and you're positive for COVID, it's okay to seek medical care. You need to tell them that you're positive for COVID. But guess what? Your child, if you don't have anyone to help you with your child, it's okay to get that medical care for your child and to let them know that you're COVID positive and that you have a very sick child. We have great emergency rooms, we have great urgent cares, and they will see you and they will guide you and take care of you. Hydration is really key with this virus, and it's really key to getting little ones better. So that's the big thing. So like if a baby is breastfeeding, for example, but you've seen a decrease, right? Then I would get advice from the physician on what else to give the baby. If the baby's old enough to do Pedialyte, a little water, juice, whatever, but it depends on that physician advice as well. But its hydration is really, really key to this virus. If your child is older and they're eating and drinking, but all they want to do is drink, then give them all the fluids that they're able to take, because that's going to get them through this and past this. If your child is recovered again and still isolating, and I'm going to mention this again, and you have that backyard space. I had a conversation with a mom last year, I'll tell you a story, and she had a little one, 3-4 years old with autism, right? And they were all recovering, and she said, he needs activity. He's not sick right now. I'm doing okay. Can I take him outside? Absolutely. Because of course at that time, our schools were closed. We didn't have those teachers helping us. We didn't have those supports that we would have normally had. And so she and I talked about what would be the safest way to do that. And she had a backyard. It was enclosed. There was nobody around. And she was so grateful because they need that space. They need that time. Even, they're recovering. And I've had lots of phone calls with little ones kind of bouncing off the walls. As they say, playing and having a good time, because they're recovered, but mom and dad aren't so. and there you are, not feeling well, right? And your kids are like, oh my goodness, making you crazy. So take a breather, think about it, and see if you've got somewhere that you can do it safely. Because they do need to be able to play. They need to be able to be active while they're recovering. I think that's really critical. I'm expecting, how does COVID-19 affect my unborn baby? So we had a study released, it's out of the University of California, San Francisco. It's called Priority, you can Google it, and just put Priority COVID University, San Francisco. It pops up in your browser. And they released that study in September of 2020. Actually, I referred a lot of folks to that study early on in New Mexico because they were the first ones to start gathering information. And I said, well, if you want to talk to somebody, I know folks that want to talk to you. So let's find out. Let's see what's going on. And this study really looked at when mom was COVID positive early in pregnancy, so that first trimester. And the good news is babies have done really well. Babies in New Mexico have done really well. So earlier in pregnancy, they've done well. If the second trimester, third trimester, you might get monitored more frequently because that's puts you into a little higher risk category. What happens is because you've got the baby going on and that impacts your immune system, then the symptoms, right? And so it makes it harder. Now, that's not to say that women early in pregnancy, especially if you're having morning sickness, doesn't start all over again if you get COVID, because it does, and it's very scary. So I don't want to minimize that. But it does increase the severity of COVID, and the severe impact to your pregnancy increases with each trimester, is what I'm going to say. So it puts you into a bit of a higher risk. Babies still have done very well. But you do want to talk to your provider about it. I would like to get vaccinated. Is it safe? Yes, actually it is. So Pfizer just started, beginning of January, the first study on pregnant women. I'm hoping to see some information from them fairly soon. We're not, unfortunately, they did not include pregnant women in the studies between Pfizer and Moderna, right, last year? But guess what? Women got pregnant during those trials. So they did follow up. They were small groups, but they all did well, and the babies all did well. And then we do have smaller studies that are showing that the vaccine is not crossing the placenta. There's one that came out of Northwestern University. There's one that came out of Israel on breastfeeding, and one that came out of Boston on breastfeeding as well. What's really important is protecting yourself from getting COVID and not affecting your unborn baby. And the reason I say that is because it's harder on you. Yeah, the baby may do well, but we can't guarantee anything because it's a virus and of all the variables with the virus. So I think what's important is you thinking about what you need to do to protect yourself. So if you decide not to get vaccinated, that's your choice, but just keep thinking about how to protect yourself. Because even though you might get COVID one time, there's a 90-day window of what we call immunity. You can get reinfected. And that is what we are seeing this year. We are seeing people be reinfected. The other question is, I had COVID-19, and is it safe to get pregnant? Yes. And I'm going to kind of wrap this up, but I want to give you, and I know that this PowerPoint is going to be on the website, and there are two really good references that you can go to. One is the CDC, and they have a great page for families on daily living, life coping, children's symptoms. That's what it's basically called. If you just type in or Google CDC COVID in children, you'll pull it up. The Mother to Baby website is excellent, and they will talk to you. I called them in March, and they answered the phone and spoke to me for a couple of hours. So I never give a website if I can't validate the source. And they have the most up-to-date, current information on COVID-19. They have everything anybody wants to know about pregnancy, and also on the vaccine as well. So it's great information for anybody who's pregnant, thinking about becoming pregnant, whatever. Oh, and breastfeeding as well. So, and thank you all so very, very much.
Wow. I knew this was going to be excellent. I learned so many things, and I'm going to be able to help so many people. Thank you, Susan, for being this expert in this field that none of us, most of us, don't know about, but you do. So we are so grateful to you. I always like to close with a story, and today I was trying to think, what in the world am I going to do for this one? And this is called The Butterfly. So I want you to think about this. A man found a cocoon of a butterfly, and one day a small little opening appeared, and he sat and watched the butterfly for several hours as it struggled to force its body through that tiny little hole. Then it seemed to stop making any progress. It appeared that it has gotten as far as it could go, and it could go no further. Well, then the man decided that he was going to help the butterfly. So he took a pair of scissors and he snipped off that remaining bit of the cocoon, and the butterfly easily emerged. But it had a swollen body and small shriveled up wings. And the man continued to watch the butterfly because he expected, that at any moment he thought the wings would enlarge and expand to be able to support the body, which would contract in time. But it didn't happen. In fact, the butterfly spent the rest of its life crawling around with a swollen body and shriveled up wings. It never was able to fly. What the man, in his kindness and haste, did not understand was that restricting cocoon and that struggle that was required for that butterfly to get through that tiny little hole, that was God's way of forcing fluid from the body into the butterfly, into its wings, so it would be ready for flight once it achieved its freedom from the cocoon. And sometimes struggles are exactly what we need in our life. If we went through life without any obstacles, perhaps that would cripple us. We would not be as strong as we could have been, and perhaps we would never fly. Now, you are probably going through, listening to this, some struggles in your life. So how are you going to think of that butterfly in the future? And how are you going to use the struggles that you're going through right now to help you to become the person that can truly fly? And that's what we want for you. So thanks for being with us today. We hope you have a wonderful workshop and that this is very, very helpful to you. Bye-bye.